नमस्कार। स्वागत है आप सबका इस पॉडकास्ट में एकेडमिक विजन एंड मेडिकल इनोवेशन अ डायलॉग विद प्रोफेसर विनय पाठक, वाइस चांसलर कानपुर यूनिवर्सिटी. So it's a unique initiative of our president, Dr. Sunita Tandulwadkar, and today we are doing 167th podcast. I welcome you both, my super guest and my super host. And today it's my privilege to welcome you all this platform. Dr. Sunita, then I will introduce Madam first and then to you, sir, and then we'll start the dialogue. Madam is our president, Fogsi. This is Federation of Obs-Gynae Society of India. And it has 46,000 members, gynecologists all over the nation. Madam is a great visionary and she's a rare combination of clinical brilliance. Besides that, spiritual grounding and purpose-driven leadership. And it is very well said, when the leadership becomes service, transformation follows naturally. This is one of our most unique and futuristic initiative, Gyan Pravah, Fogsi's first ever podcast platform, making scientific and also inspirational conversations accessible to every gynecologist, every woman, and everyone on this platform. She has launched many programs for the women welfare, for the women empowerment, and Sampurna, Aparajita, Fogsi, for every Fogsi and Anubandh, PACE for postgraduates. But it's not the matter of programs. It's a revolution and which is anchored in values, guided by clarity and carried forward with grace. Madam is a senior IVF specialist, senior endoscopist at Pune Ruby Hall. She's director there, and she has dealt with many women and they're given them the life, new life, and the happiness of into their life has come into their life. She also works into the stem cell. So I would request, Madam.
Thank you,
A few
Kiranji.
words.
Thank you.
And I'm
Thank you
very
so much.
thankful for giving me this opportunity to do this program at this platform.
Thank you, Poonamji. And sir, thank you so much for coming on a Foxy platform. It's our honor and always a pleasure to listen to the legendaries like you who are now Vice Chancellor of the University. There is so much more to learn, and I'm sure Kiran will take through her interview, through her podcast, and it will be one of the kind podcast for all of us. Foxy has now crossed 165, 166, and today is 167th. It's wonderful to know. Meeting those many personalities every day at 8 p.m., it's a great pleasure. It's evolved, as you said, it may be scientific background or it may be some other inspirational platforms, but it is a wonderful journey. More than you all, chairperson, I'm enjoying the most meeting those legends. Kanpur University, I know because once upon a time, my interest is in stem cell, and I know once upon a time, huge stem cell work was done in Kanpur. I'm not aware about the recent situation, but when any university takes such leadership role, probably the research values and it comes into the implementation of our day-to-day practice. So that is what I heard about the Kanpur University long back with, I don't remember the names of those scientists who were working on that, but definitely I'm sure they must be doing a great job. Thank you, Kiran, for having me also in your podcast, and thank you, and I wish you all the best.
Thank you, Madam, for great words. And once again, thank you for giving me this opportunity. And with your permission, I'd like to introduce our guest, Dr. Professor Vinay Pathak ji. He is not only Vice Chancellor of Kanpur University, he is also Vice President of All India Universities. His academic background is very high up. He has done BTech, MTech, and even PhD, and he is he has looked after many societies, many universities during his tenure. He has served as Vice Chancellor at AKTU Lucknow, Uttarakhand Open University, Kota University, and the Language University of Lucknow, HBTU Kanpur. He had an additional charge. He also had additional charge of Bhimrao Ambedkar University, Agra. He was former professor and dean at HBTI. He has been doing many work there in all these universities. And he is, beside that, he is member of NEP, that National Education Program Task Force, Government of India. He is member of AICT Board of UG Studies. He is member of NCERT, NUPA Council, Council of Science and Technology UP, chairman member, several vice chancellor appointment committee, and he has very significant research and academic contributions. He has done 37 journal publications, more than 35 conferences presentation, and he has guided number of PhD students. He has been awarded for Global E-Learning Award and Humanitarian Award 2021. His very unique and key initiatives are that he has launched basically digital platform at every site. Biometric has been introduced by him, online grievance portal, and many more he has been doing. He has also started Google-sponsored coding lab, smart city simulator lab, established university industry interface cell for placements, and signed many MOUs with very significant significant organizations. He has started Value Education e-office, Nalanda e-library consortium. He also works for women empowerment and inclusion. He has distributed laptops to many girls at UPSC, started scholarship, student welfare fund, startup support, and promoted girl education in many ways. He has medical and multidisciplinary education focus, supported lot of skill-based institutions, interdisciplinary learning through incubators, and insisted many skill-based health and design institutes. He has been working and even infrastructure. He started APJ Abdul Kalam Memorial, Center for Advanced Studies, incubation startup centers, green campus, and so much. His CV was very long. Sir, I with due permission, I made it crisp, and still it is. I mean, achievements are many.
We can start the podcast.
So,
Thank you, Kiran, and enjoy your podcast.
Thank you, madam. So, sir, I know you are. Hello. So you are very busy. So we'll be straight away come to this. And I just now I've read you have started your journey from HBTU Kanpur only. So HBTI. So that time it was HBTI. So what would you like to share your leadership journey, leading through the many universities from the earlier days, what challenges you faced, and how you navigated multiple VC roles, even additional charges. So will you like to share your experience which has come out to everyone, how you the
Thank you. The nice introduction, and thank you, Kiran Madam. You are one of the celebrity we have in Kanpur. Thank you for inviting me to the state podcast. thanks to your president and thanks to your organization. Your first question, which was there, that what has defined your leadership style? I think leadership is a art, or leadership is a journey which is felt by people, which is felt by stakeholders. I always felt that impartial decisions and quick decision, these are two important things which I have got virtue from my parents and my gurus to have, and I have ever maintained this. Taking swift decisions, fast decisions, and impartial decisions for the organization and by the organization is his first leadership style, which I really want to say in 2 words. The second question which you asked about the navigating multiple VCs role, what are the challenges? As a grace of God, I always have the responsibility of public funded universities, and public funded universities are good. They have got good people, but then there is a famous quote of file yatras. So file keeps on traveling, files keep on traveling in the red tapeism. Whatever good program you have, whatever good things you have, whatever good ideas you have, they go in the red tapeism of the organization. I felt this was the biggest challenge with us, changing the culture of an organization, changing the culture of the university, changing the culture of understanding about the problem of people. I think this was the biggest challenges, and by the grace of God, I overcame this challenge. And wherever I work, I try to change the kind of behavioral practices, change the DNA of the institution by taking the decisions, doing everything about that. So these are the two simple answers, which first of two your questions are there.
Sir, I really endorse you because we know it. I remain in the Kanpur Medical College. I have been there, so I know your quick decision powers and how. And I'm very thankful in your busy schedule, you have given me time for this podcast. And red tapeism, of course, that's very, very important. Sir, we know that how much you have done for the university and how it is. And this is the reason it is progressing. Sir, recently, let's talk about something related with the medical colleges, because I've been part of it, and the medical education. I'm chairperson of medical education committee in Fogsi. So this new curriculum which has come by the NMC, CBME. So just want to discuss something for the benefit of our postgraduate students. These reforms have redefined the medical education. So how has the universities embraced this change? And again, what has been the biggest challenge in implementing it so far? Faculty readiness is the thing, infrastructure is the issue, or the student acceptance, or whatever you might have. You can tell from your experience what has been the journey of this CBME
So,
for last 2 years.
when I look into this medical education of the country, our podcast is going when we recently have seen a big story in medical education where I think the CBI has actually unearthed the kind of corruption we have in the medical education. I think medical education was basically a very pious kind of an education which the country has. Unfortunately, we are looking into the medical education into this era where we are looking into the mushrooming of medical colleges, not readiness of the faculty. I think the patients are not there in the hospitals, the new educations and the new medical colleges which are coming, forged kind of biometrics. These are all things, I think it was unfortunate, but it has come at the time when we are doing the podcast. I think one important thing is the reforms. When we talk about theoretical reforms, we talk about the theoretical reforms in the new education policy. So now this the new competency-based medical education which is a new kind of an education which has shifted from the traditional knowledge to the based approach. I think the competency-based medical education requires lot of honesty from inside, which our society needs at this stage. It is a sorry state of affairs that we really cover up every and important thing. I think as a university vice chancellor, I don't have any grudge to say that it's duty of all professors who have come from a harder kind of or from the older medical education to save the medical education into the new form. Because if a person from art side do something, it has got minimal impact. If a person from engineering, maybe the man-made machinery may fail. But if the doctors fail or doctors become incompetent or doctors get a false degree, then the biggest machine which was created by a god, the human machine, may fail, which has got an irreparable loss. Because the other machines can be repaired, they can be actually changed, they can be replaced, but the human machine cannot be replaced. So we welcome this NMC competence-based medical act, but then there is a thing that how they will be evaluated, how they will be implemented, how they will be having the infrastructure. When we don't have so many competent faculty members at medical colleges, how it will be implemented. We have got thousands and thousands of patients, but we don't have machineries. We don't have new state of technology in medical education at the point. Our doctors are good. They are one of the most comparable and most competent doctors in the world. Their OPDs are high. But as well as you see that we have got now the artificial intelligence, we have got now the deep imaging, the new researches is being done, and in the era of the artificial intelligence, and people say, and as you see that the Google AI boss has said that, who is heading the medical fraternity, that it's the time when in years we will unveil like Alzheimer, Parkinson, and all other diseases which are autoimmune diseases, because we have got a lot of competition power. At this juncture, we have got young doctors, we have got young professors, but it's a time when we have to adopt technology, we have to adopt honesty, we have to increase infrastructure, and we have to really see our country is good in making the kind of curriculum framework or competency-based kind of thing on new education. But how it's implemented, it's very, very important. And this is a time when we have to do that. So I think this is the best thing, is that we adopted a best kind of thing which is in. The challenge is that how to adopt, when we will be able to adopt, and how fast and swiftly we will be able to do due to this challenge.
So very rightly you have touched that core of the problem. Actually, that is what I was thinking. I do remember when I was in my department, I was the first person to go for this training. And it is so beautiful. CBME, they have skill-based things are there. If they're really adopted, the students will learn much. So how do you think, sir, skill lab? But the thing is, what I felt at that time, that we don't have those skill labs. So how do you think, sir, they can be provided? You have touched that question, and that was at the time worrying to everybody. Those skill lab was supposed to be opened, but I don't know yet. It has not been, maybe the same word which you said, red tapeism, or it has not yet come to the ground to actually materialize. So how do you, I mean, with this, all these challenges, how will, I mean, it will materialize? And what impact it will have over the medical education finally?
We have got all the capability to do the things, but we have got two kind of institutions. One, our government institution, which has got topmost brain and topmost kind of students. They are in the red tapeism. They are not able to flow in that direction. Others are self-financed. They don't have the access to the best faculty and the best student. So they are doing something which is cosmetic in things. I think the solution lies between these two. So we need a lot of good skill labs. This is not that we cannot do. We have got a lot of CSR, we have got a lot of people from society, we have to engage them, we have to think differently. Apologies for that, but the medical doctor only feels that he is only that if he has seen the patient and done with the disease is gone. No, he is the person who has to work on technologies, work on data, work on skills, work on new things. So he has to be a compensating of all those things. So there should be a kind of a change in the mindset of faculty members, doctors, medical professionals to do this kind of skills what you have started. So the competency-based kind of a medical education is important. The skill is important. So we have to do. We went to Singapore. We have seen how to keep in the ambulance is also taught in a very deep detail. How do they have got simulators? They have got machines. They don't have people, but we have got people also. We have got real-time examples. So I think we can be one of the best in the world to do this kind of a skill-based competency. So I think all of us have to work together, the society, the professor, the government, the people, to maintain and believe me that in the world, the best doctors are from country, the best nurses are from the country, the best paramedics are from this country. And we have to just train skill in. Once upon a time, the Europe or the London kind of a thing or the UK was not accepting the Indian nurses. Now I went to Ireland, I went to London, they are accepting and they are saying Germans, they are saying only we need Indian nurses. So they need some skill course and these, I think these skill, they have to give one more test there to have their certification. I think this certification we can inbuild here. So these kind of skills competency in paramedic, and this is, I think, one of the places which I really feel after being a computer science and IT graduate, that as CS and IT, the people world are ruling. Now this is the turn for paramedics, doctors, and the skilled people in medical sciences to rule the world like once the computer science and IT has ruled the world.
So wish this all can happen, because really we have the human resource is very good, as you rightly said. Even in private, the persons who want to take treatment, they want treatment from medical college doctors, but they don't want to go to the government hospital because the other facilities are lacking. So that is very rightly you have said, the course, if we are able to take those skill labs and simulators and other facilities and even infrastructure, I think so that is also very important. The strengthening of the infrastructure is also very important, workplace facilities. So what is your experience? Do you think it will finally succeed with these government institutions with the existing resources in coming time? Because it is the soul of this program is very good. They has been designed very good, and if the doctors are trained on this, definitely they will be able to serve the society very properly as required. But presently, how we can reach to this goal?
I think the medical fraternity is one fraternity, or the doctors is one fraternity, which is very, very closely associated with the topmost person to the bottommost person in the society. They treat the richest, they treat the king, and they treat the poorest. So when they treat kings, the kings are really indebted. They are not as indebted by any other fraternity of teaching as they are indebted by medical profession. I think the government institute is a time or not, we should depend only on the government kind of grants. We should also depend what is our Indian tradition. We have looked at the society has to give back to the society. That's what we were taught in the Indian ethos. I think those things should come. Medical college should also think differently. Out of box thinking are required for the government institutions to take things from the society and use back to the society. I think if we will follow this, because no government will be able to give all the grants anytime. And medical and education cannot be also profiteering like private medical college as we are serving the common people. So the only way which is left is to take from the society, to invest from the society. And there are enough people. Once you do a heart operation, or as you're a gynecologist, you give birth to a new point of any rich person, they are willing to dedicate some of the money. So if you have got good projects, if you have got good intention, you can go back to them and say, I think if we start doing this, we will succeed very fast. And there is a will, there is a way, what the earlier kind of things. So I think we can get success.
So very right. So you have not only worked in the UP, but you have worked all over the country. So is it the same situation everywhere, or
More or less, ma'am, our Indian ethos or Indian bureaucracy is same. Somewhere it is much complex, somewhere it is slightly simpler. But the human minds or the human mind speaks like anything. So in this country, we need a lot of discipline, we need a lot of thrust, we need a lot of force, and we need an autonomy in the kind of a stringent thing. If we give more autonomy in the government system, then the anarchy will also come. So I feel that institutions have to go in another way. They have to get the things done in a different way.
yes, so some autonomy should be there, but of course not overall. So what do you think? Faculty capability, they also have to be trained into this. Mindset is very, very important, because the traditional faculty teaching, that teacher and the student, and I think CBME mindset is absolutely different. They have to be there.
All these new policies which has come, either the new education policy or CBME, actually based on one thing, which is lifelong learning.
Yes.
Teacher is not only a teacher, he's a student. He has to learn all the way. Now you are retired, but you are also learning every moment. So in this lifetime, like Upanishad says, that we have to learn till the last breath of our body. So we need training. See, once you look to a medical thing, I will just pause you. 30, 40, 50 years before, when the scanning came, it was a big thing. We were not having any MRI machine at Kanpur. We used to go to Lucknow. Now there are hundreds of MRI machine in Kanpur. Now we are going to AI-based machine. We are going to more and more kind of imaging. We are going to having more and more kind of machinery which can assist us in technologies. So as we have got more and more machine, we need more and more skill to use that. More and more skill, that kind of a training. So now the new medical sciences are not only the medical sciences of diagnosis or medical sciences of diseases, it's also the new engineering things which has actually fused into the medical sciences. You look to the Department of Radiology. So it's not a medical, you look to the things of endocrinology. So it needs a lot of machines to do all those things. There are a lot of new tests has come. There are a lot of new genetic tests has occurred. There are a lot of new things which has not only due to the medical. So medical doctor is no more only the diagnostic doctor or only giving the medicine. He is a doctor of new kind where he experiments with the new kind of diagnosis, with new kind of other thing. So it's a totally different. So he needs a lot of skills. So suppose a surgeon was there 30 years before, an eye surgeon was doing with that nitrogen kind of a thing. Now they do with the phaco and the new other kind of a machine, 5 seconds. So big task which was 50 years before was a trauma, like eye operation, IVF kind of a thing, knee enhancement, or the knee replacement or thing. They have become a daycare kind of a thing today. So this is a fundamental change. It is due to the machinery, it is due to the new technologies, it is due to the new inventions which we have made with the medical science. I think India is very good in adopting them. We have got in numbers of cities to do that. We have got numbers of patients which our Indian doctors see. I think it's a mind-boggling. In the US or some countries, the patient which you see daily, they may see in a year's time. But we need a lot of other kind of things because our populations are different, our needs are different, our holistics are different. So I think this is a time when we should work with older ethos and new technologies.
Absolutely correct. And probably that is the reason that Indian doctors going outside, maybe US or maybe Europe or England, anywhere they go, they succeed more because they have that basics into them. And when they get those facilities and the techniques, then they really do very well. Sir, when you are talking of this and you have so much knowledge, I really say you have knowledge of each and every medical aspect also and otherwise. What do you think? AI can replace the doctors ever, or what is the role of AI into the medical field and how much it can do justice?
See, a very, very important thing is that whatever we are saying AI is artificial intelligence, but we had got a new paper which is came from Apple scientists some 10 days before. They say that AI is there, but AGI is not there. Artificial general intelligence is there. It will take some time. But AI give us a lot of good new promises of giving the new low cost technologies. Like today we have got pathologies. So the pathologies are sometimes very costly, or imaging is very time costly. So AI is a very good assistant. AI can predict with a bigger database that suppose you have got a kind of a ultrasound of thousands or 10,000s kind of a thing. So if I have brought thousands of ultrasounds are being trained, and now you get an ultrasound from a hospital or from a rural kind of a thing. So if it is put in this and came to Kiran Pandeji, so she can always feel, yes, I have got thousands. This is the probabilistic disease which can. So they can faster assist you and in the low cost. So she doesn't have to come from there like a breast cancer or like the other kind of. So diagnostics can be become cheaper, the assistance can become faster. So these are the new promises of AI. And like in a deep imaging, so if you have got X-rays only, so if you have got X-ray, if you have got CT, MRI, so thousands of people you have trained. Then if you get an X-ray and that patient doesn't have the capability of doing MRI or CT, so you can put into that and you can say by probability, this may be your disease because it's with the probabilistic thing. So AI can make these things faster and more assistance and more, see the whole IT or whole technology or AI are social equalizers. So they can do more social equalization. So, and that is what we are really struggling for. We have got people who can pay lakhs rupees for delivery, but there are thousands and lakhs of people who doesn't have 1 rupee for making a new delivery. So equalizing the things, because if we have got 10 iconic hospitals that cannot serve country, but our country needs lack of that services to the common people. I think AI will leverage down those things to the newer generation. I think that's the best use of AI, which I can say at this moment. But let it be unfolded. And the second important thing that AI can unveil, like you see when the Ebola virus came or the other virus came, it took years to make a vaccine. But when COVID came, because we had a lot of computational power, it took only 4 months to make a lot of vaccines. So AI will also unfold what was in medical sciences for long time has not happened due to computations. So it will fast computations and make those things available for you in new researches, which was not possible, I think, 10 years, 20 years before.
Yeah. Yes, sir. This, I mean, very good message to all those young doctors also that they should take the, I mean, use, I think so. What you want to convey is use AI as assistant. Then it is a very good tool. Of course, clinical judgment has to be there with the AI help.
Be done by the annual general artificial general intelligence. That will take time, maybe years whether to come to the machine or may
Yeah,
not
but
come.
it is also said that it is coming very soon.
Maybe. But people were saying when the imaging will come or things will come, people will feel and this will go, the job will go. Nobody's jobs go. Even we need a lot of good doctors now also to interpret the things.
Yes, yes. And it's going to help into the researches also, which is little weaker part of Indian doctors or otherwise, I
They
feel.
have never tried research in that way with the best source. we have got the biggest data in the world. We have got biggest good doctors, but as we are very poor in data recording and publishing,
That is
that's
right.
our researches are very good. We have done wonders and wonders, but our doctors are very poor in those things.
So we are not able to project it. That's the probably
They
the
don't
thing
let
which
us
we are.
record properly.
Sir, of course, with people like you at the helm of the affairs, definitely we will be able to do more. So the one more aspect I just wanted, because I know your interest and your alignment to do the women work for the women empowerment also, and I have seen so many of in your the curriculum IT that you have done so much. So what do you think? What role the universities play into the promoting the gender sensitive medical education?
Foremost duty of the university to have gender sensitive, the equal society, and all those things. I think now the days are gone, and we have got in our girls students are more than the male students. Our medal taking students, female candidates are more than the male. So things are changing. Things are changing rapidly. I think the society is also changing. They are treating their girl child as a boy child. In fact, some families are feeling that the girls are much better than the boys. So I think we are moving in a very, very right direction. And jokingly, some people say that the way we are going, male child may need reservation after some time in the universities.
That's an interesting thought, because maybe situation may come someday, but actually the general public still there are sometimes still लड़का चाहिए वाला चीज, या लड़की हुई तो चेहरा थोड़ा सा डाउन हो गया उनका, ये
I
अभी भी
think
हम लोग डॉक्टर्स की तरह फील करते हैं.
gynecologists have to tell them more on board because first encounter of a pregnant woman comes with a gynecologist. So they
Yes.
have to tell them the social ethos and all other things. Because our Indian ethos were actually more towards getting the women or the female candidates as a kind of thing, because हमारे यहाँ तो सीता राम राधा कृष्ण, so these were built in the Indian ethos, देवियों की पूजा and all those things.
Very right, sir. Our Indian literature, the old tradition, always given the values and to the women first. But something happened in between and the situations change. So anyway, it's good that women are reaching, the girls are reaching at the top of almost every job fair, wherever it is possible. So one thing, we are, because doctors, we are gynecologists and obstetricians. So what about women health? Is it adequately addressed in our curriculum presently, or do you, if it is possible in your capability, would you like to add more into it, take more initiatives?
I think that's a big question which we have to answer, and it is not properly done, not in the curriculum, but not in the practical. Even the females which are very, very literate also don't care about their health due to the family kind of design we have, and especially the women from villages does lack. So I think lot initiatives have to be done by societies like you to come to the university, to work among the girls, to work among the females. And if your society is interested, we are also interested in the university, that you launch this kind of program, teach them, do some practicals, do some skill-based kind of a course. We can adopt 10, 20 villages and start in a nearby area. So that needs a lot of attention.
So any these programs, projects, that way, sir, I would like to inform you, Dr. Sunita, our president, has started Sampurna CME. This is with the idea of preconceptional care. because we are talking presently for years together from conception to delivery. But pre-conception, the problems, as the researchers are going on, they starts from the preconception period. If the women health is taken care at that stage, she conceives into the right phase and then she carries. So this
I think,
such
I think,
type of initiatives
I
are
think because we were having this Garb Sanskar course, which was actually started from a very pre kind of thing, how to conceive, when to conceive, and if you are conceived, what to do, and all those things. I think these are needed. So these are needed from the Western ideas as well as the Eastern ideas. There should be fusion. They should be taught. There should be behavioral thing. What should happen? What parents should do? What husband should do, what in-law should do, and what the society should do with a honorable pregnant woman. So those kind of things are really needed at this juncture. I think to have a good and sound child, or to have a good and new the successor of this thing, we actually require these kind of things.
Yeah. So I know that initiatives, and I was lucky to be part of it as a medical teacher into that. And it was a very good program. So, like breast cancer awareness, cervical cancer awareness, these days, the pollution problems, there's so many. I think they all can be, as you can bring about many changes. You can think revolutionary, so you can think of these programs also.
I think I think with this cervical cancer, we have already done the vaccinations. Breast cancer, because our Honorable Chancellor Srimati Anandibin Patel ma'am has instructed all the universities. She has come to these things, but we need in a very big way. Country is big, people are big, number of peoples are there. I know that we have given one vaccine, but the second vaccine, a lot of girls have not come back. I think this needs a lot of reference. It cannot be done in a podcast, or it cannot be done in 2 words. It needs a lot of hard work from a lot of people to achieve this kind of thing. So if your society or if you yourself are interested, we can have the deliberations, and we can look forward for doing all these things.
Definitely, sir. That is a great idea, and definitely we would always like to part of it. So I know with your will, with your strength, with your vision, we can always do it. As again, let's come back to your vice chancellor. At the moment, you are looking after such a big university. So, any plans for further expansion, including the health, paramedical, community program, or anything else which you are thinking,
I think these
which
all
can
things,
further give
these all things asked is very close to my heart. We have expanded the paramedical double the times we have. We have gone into the community. We have got into the inclusion of health programs, but they are very little in the thing. That's a tip of the iceberg which I have to do. We have to go deep into those things, deep into these programs. It's really to my heart, all these things, but we need people to do that. We need people like you to come forward to us and do these things. So a lot has been done, but a lot has to be done in these programs.
So I think, as you said, people like us. So if any program of the university is there, we are always there. Our Foxy is always very ready to take part into
We
these
will
initiatives.
have a deliberation, and I think you come one day so we can discuss with our heads and dean, student welfare, and all those things. And let us have, because our semester is starting, so we can do in another 3 months lot of programs with you.
Sure, sir. Sure, sir. Thank you. Sir, one last few things. Like if you ever get a chance, or if you must be thinking of this, any transformative change if you want to do Indian medical education, so what do you think you will like to do?
I
As
will say one thing at this juncture: teach AI to everybody. That's the crux of the thing. That will bring wealth, that will become research, and that will make to the next kind of coordinate. So this is one thing which I request to all the doctors to read at this time, or do this kind of things.
yes. So, I mean, people should not think AI is their enemy or something. Start using it as as helping person or assistant or guiding or research helping into the. Yes, definitely, I agree. So you have also established a green campus. So what is the further plan for that? Because this is also a need of the hour, the environmental, what we are going to give to our progeny. We have almost done our life, but what we are going to hand over to our progeny, this.
I think we are moving towards the sustainable campus, not only the green campus, which is the need of the hour, no plastic, emitting less green, less carbon, and all those kind of things. So those are important things. Tomorrow we are planting so many trees. You also come. We are making a Miyawaki forest, which is one of the forests of its own kind in this things. So these are the important things which are doing. Our campus is already green, so we have got 62% kind of a green campus and green cover. But not only making green campuses, but making less carbon emitting kind of a campus, more sustainable campuses are the need of the hour.
Yes, that is the, otherwise we have seen many in medical, many complications are happening these days, like infertility, so much effect because of the environment and population. I know, sir, you are very busy, so I will not take much of the time. Only just one or two things. One initiative you wish to implement nationwide.
One initiative we wish to implement nationwide is that I want to make this society free of abortion of girl child. That is what is one of the important thing which I really want, because our society is also facing, although we are the youngest nation, but the kind of thing the UN has said about the rate of the fertility is going less, and I think the nation will face a skewed kind of a population, which is not good for the society in social sense. So if, as we're linking with you, I really want to do this kind of a thing and no abortion of more.
So what will be your advice to the aspiring medical educators and public health advocates? This is your message to them with this our podcast from this platform.
So one aspiring medical educators which I really want to see is that I really want to request that all the medical educators should go to the ethos and basics which they have followed for a very long time. Sarve bhavantu sukhna, sarve santu nidana. Rather than going to everybody should become ill and they should earn a lot of money. So I think our Indian ethos is very, very, so that is what I want to say to all educators. Make a society, make a hospital, make a ecosystem of health so that we go back to our basics.
Thank you. Thank you very much, sir, for your inspiring words and for leading us throughout this program. Thank you for your message.